I really don't believe in taking a medication to counter the side effect of another medication. Hello my friends, welcome back to the channel. This is your friendly pharmacist Kweku coming your way with yet another medication review, and today we're going to be talking about Lisinopril, one that I call an oldie but goodie because it's been around for so long and it's been prescribed, one of the most prescribed blood pressure medications. We're going to be taking a look at what it is, how it works, some of the uses, some side effects obviously, and then we will take a look also at some precautions or some best practices that you should know about if you are taking Lisinopril or if you are considering it. So first off, what is Lisinopril? Well, Lisinopril belongs to a group of medications we called ACE inhibitors. The long word is angiotensin converting enzyme inhibitors, but you would agree with me that that is a mouthful, so we call them ACE inhibitors for short. So how does Lisinopril work? Lisinopril works by blocking a certain chemical in your body, this angiotensin converting enzyme that we talked about. Now, in the presence of this ACE, what happens is that the blood vessels become constricted and therefore blood flowing through it becomes more difficult, or in other words, there is a resistance to blood flow. So what Lisinopril does is that it blocks this ACE, and in doing so, the blood vessels are able to relax. It's easier for the blood to flow through it, and therefore decreasing your blood pressure and making your heart also work more efficiently. Now, when it comes to the uses, the obvious one is to lower blood pressure or in the management of hypertension. Lisinopril may also be used in conjunction with other medications in the treatment of heart failure. In some instances also, Lisinopril may be used to improve the survival rate after a heart attack. In other words, when some people have a heart attack and Lisinopril is given within a certain time frame, chances of survival is dramatically improved, and therefore Lisinopril may be used in that respect as well. Sometimes Lisinopril may be given off-label to manage diabetic nephropathy. Now, diabetic nephropathy simply is that when somebody has diabetes, there's a tendency for the kidneys to get worse, and Lisinopril may be given to slow down that process. Now onto some side effects of Lisinopril, and you can never talk about side effects of Lisinopril without talking about a dry cough. That is arguably the number one reason why a lot of people are not able to stay on Lisinopril. And this cough can be very irritating, can be very persistent, and most of the time if you ever fall into that category that reacts that way, your doctor may have to find an alternative for you, and there are so many other alternatives that you can choose from, so you shouldn't suffer through it. I've also, I've seen instances where people have recommended taking an iron supplement to mitigate that cough. But personally, I am not a big fan of that approach because I really don't believe in taking a medication to counter the side effect of another medication. Then you get into what we call prescription cascades. You just keep prescribing to take care of the next problem that the prior medication caused. Because, and in this scenario, there are good alternatives to choose from. So I'd suggest that if you ever experience that dry cough, the best option is to talk to your doctor for an alternative. Other documented side effects include dizziness, headache, and sometimes hypotension. And hypotension, that means that maybe the medication is working too well for you, where your blood pressure dips too low, and that can become an issue for some people. So if that happens, maybe a dose adjustment may be needed. So do well to discuss with your doctor if you experience any kind of lightheadedness, especially on standing up. So we do recommend that when you start taking Lisinopril, or when you change a dose, especially if you increase the dose, when you're going from a sitting to a standing position, do so gradually so that your body can get time to, just get used to your environment or your surroundings. Some people also complain of decreased sexual ability. Some people may also complain of a rash that occurs. And in respect to a rash, I'd suggest that if you develop a rash when you take Lisinopril, to, especially if it's accompanied with some kind of blistering, to let your doctor know. There are some serious rashes that are a reaction to the Lisinopril, which needs medical attention. So if you notice any rash, do well to let your doctor know. Lisinopril has also been associated with elevated potassium levels. So you want to be careful if you're eating foods high in potassium, or if you're taking any kind of substitute, to be careful, because in combination with Lisinopril, it may make your potassium levels go beyond what is the accepted norms. Now, some best practices and precautions that I promised. Number one is do not take Lisinopril if you're pregnant. Lisinopril can harm the fetus. And also, while taking Lisinopril, if you suspect that you're pregnant, please do well to let your doctor know. They may find other alternatives that are safer for you and the baby. Number 2, lisinopril can affect some people's blood sugar levels. Some people may experience an elevation in their blood sugar levels when they start taking lisinopril. So not a bad idea to monitor your blood sugar levels, especially if you are pre-diabetic, just to make sure that it is not going beyond what is accepted. Also, if you have a history of gout, do well to let your doctor know. Lisinopril sometimes can increase uric acid levels, and uric acid is the guilty culprit when it comes to people with gout. So do well to let your doctor know, and just to make sure that lisinopril may be appropriate for you. Lisinopril may also cause what we call photosensitivity, or in other words, it makes you more sensitive to sunlight, and that can cause irritation and a rash for some people. So as much as possible, avoid staying in direct sunlight if you're taking lisinopril. If it's not possible, then think of using a sunscreen or wearing clothing that cover most part of your body, if at all possible, just to reduce the tendency or the risk of developing photosensitivity. Also, if you have a history of kidney disease, do well to let your doctor know. And I know I did mention that lisinopril may be given to slow down diabetic nephropathy. That is in the initial stages when your kidneys are relatively healthy. But once your kidneys cross a certain threshold, lisinopril becomes is not as beneficial, and it actually may be detrimental. So if you have kidney problems in the past, of course, your doctor will monitor your numbers and know what and when to stop your lisinopril. But definitely a good idea to bring it up, so at least you guys are all on the same page when it comes to your kidney function and you taking lisinopril. And as I mentioned earlier, also be careful about what salt substitutes you're taking, especially the ones high in potassium. Lisinopril, when taken with these salt substitutes, may greatly increase your risk of developing what we call hyperkalemia, or elevated potassium levels, which can lead to irregular heartbeats. It can lead to muscle cramping and a whole host of issues. So thank you so much for staying through high-level overview of lisinopril. I hope you found some value in this. If you did, please give this video a thumbs up and subscribe to the channel if you have not already done so. I will catch you on the next video. Thank you.